Navigating power and boundaries. Navigating the complex interplay of power and boundaries within therapeutic contexts is a nuanced and multifaceted undertaking. It requires a deep understanding of both theoretical frameworks and practical skills. The therapeutic alliance is fundamentally a partnership, demanding a balance between guiding clients towards growth and respecting their autonomy. This dynamic necessitates an ongoing negotiation of power and boundaries, a process that is both challenging and essential to effective collaborative work. At the heart of navigating power dynamics is the concept of power itself, which in a therapeutic setting is not a monolithic construct, but a variable that is contextually dependent and relationally configured. Therapists wield power by virtue of their expertise, position, and the inherent vulnerability of the client. However, contemporary therapeutic paradigms, such as relational-cultural theory and the person-centered approach, challenge traditional hierarchical models, emphasizing instead mutuality, empathy, and empowerment. These models advocate for a power with rather than power over dynamic, promoting an egalitarian therapeutic relationship where the client's voice is prioritized and their agency reinforced. Pause. The theoretical exploration of boundaries provides another layer of complexity. Boundaries in therapy are the demarcations that maintain the integrity of the therapeutic space, encompassing physical, emotional, and psychological dimensions. They serve as essential safeguards against the potential for harm, such as dependency or exploitation. However, boundaries are not impervious. They are permeable and must be negotiated according to the evolving needs and contexts of the client. This balancing act calls for therapists to be vigilant, reflective, and adaptable, fostering a safe yet dynamic therapeutic environment. Professionals must navigate the delicate balance between offering support and fostering client independence. Strategies for achieving this include the establishment of clear, consistent boundaries from the onset, coupled with an openness to renegotiate these boundaries as the therapeutic relationship progresses. This requires advanced communication skills and a deep attunement to the client's verbal and nonverbal cues. Furthermore, it necessitates an awareness of one's own power and biases, which can unconsciously shape the therapeutic interaction. Practices such as supervision, peer consultation, and self-reflection are crucial in maintaining this awareness. Pause. The phenomenon of transference and countertransference further elucidates the intricacies of power dynamics and boundaries. Transference involves the client projecting feelings and attitudes from past relationships onto the therapist, while countertransference entails the therapist's emotional entanglement with the client. These processes can obscure boundaries and skew power balances, demanding that therapists cultivate an astute self-awareness and an ability to discern and address these dynamics as they arise. Techniques such as mindfulness and reflective journaling can aid therapists in identifying and managing transference and countertransference, thus preserving the therapeutic alliance. In examining competing perspectives, the dichotomy between structured versus flexible approaches to boundary setting emerges. A more structured approach advocates for firm boundaries to prevent ethical violations and maintain professional integrity. In contrast, a flexible approach allows for the spontaneous and organic evolution of the therapeutic relationship, which some argue can deepen trust and authenticity. The strengths of a structured approach lie in its clarity and predictability, reducing the risk of boundary crossings. However, it can also stifle the relational spontaneity crucial for deeper therapeutic connections. Conversely, while flexibility accommodates the unique and evolving needs of clients, it risks ambiguity and the potential for boundary violations if not carefully managed. Integrating emerging frameworks such as trauma-informed care offers novel insights into power and boundaries. This framework highlights the importance of safety, trustworthiness, and empowerment as foundational to the therapeutic process, particularly for clients with trauma histories. It suggests that traditional power hierarchies can re-traumatize clients, advocating instead for shared decision-making and collaboration to foster healing. This approach underscores the necessity of adapting boundaries to prioritize client safety and empowerment, challenging therapists to rethink conventional power structures within therapy. Pause. To illustrate these concepts, consider the case study of an outpatient therapy setting designed for survivors of domestic violence. Here, the therapeutic relationship must be acutely sensitive to power dynamics, as clients may have experienced profound power imbalances in abusive relationships. A trauma-informed approach is crucial, requiring therapists to maintain a vigilant awareness of boundaries while fostering a sense of empowerment and autonomy. Therapists might employ strategies such as collaboratively setting therapeutic goals and involving clients in treatment planning, thereby redistributing power within the therapeutic relationship and reinforcing the client's sense of agency. This case exemplifies how power and boundary navigation must be tailored to the specific context and needs of the client population. Another illustrative example is found in the context of adolescent therapy. Adolescents often grapple with issues of autonomy and authority, making the navigation of power and boundaries particularly salient. A structured yet flexible approach is often beneficial, where boundaries are clearly defined yet adaptable to accommodate the developmental needs of the adolescent. For instance, while maintaining confidentiality is crucial, there may be instances where breaking confidentiality is necessary to ensure the adolescent's safety. This requires a sophisticated understanding of ethical guidelines, as well as a capacity to communicate effectively with both the adolescent and their guardians, thus maintaining trust and therapeutic integrity. Interdisciplinary considerations further enrich our understanding of power and boundaries. Insights from fields such as sociology, anthropology, and feminist theory highlight how cultural, social, and gender norms influence power dynamics within therapy. Acknowledging these influences is critical, as they shape the client's and therapist's perceptions and experiences of power and boundaries. For instance, cultural norms regarding authority and emotional expression can impact how boundaries are perceived and negotiated within therapy. This necessitates that therapists cultivate cultural competence, adapting their approaches to align with the cultural contexts and values of their clients. In summary, navigating power and boundaries in therapy is an intricate dance that requires a delicate balance of theoretical knowledge, practical skills, and a deep attunement to the relational dynamics at play. It demands that therapists engage in continuous self-reflection and professional development to refine their capacity for empathy, ethical judgment, and cultural competence. By embracing contemporary frameworks and strategies, professionals can foster therapeutic relationships characterized by trust, respect, and collaboration, ultimately enhancing the healing potential of therapy.